Hello everyone, I am Dr.jom President, Indian Medical Association, Idinyalakuda, Consultant Physician, Bishop Alapad Mission Hospital, Karanjad. We will talk about leprosy. We will be talking about causative agent, background, epidemiology, clinical features, diagnosis, survival, treatment, control and elimination aspects of the leprosy. So what is leprosy? It's an infectious bacterial disease of the skin, peripheral nerves and mucosa of upper airway, chronic granulomatous in nature. Only few from who exposed to infection develop the disease. So causative agent is Mycobacterium leprae, acid-fast, rod-shaped bacillus stained with Steele-Nielsen. Cannot be grown in bacteriological media or cell cultures. That is important. Leprosy has afflicted humanity. It causes mutilation, rejection, exclusion from society. A lot of people suffered in the previous era. It was diagnosed by 1873 by J. Hansen, hence it's called Hansen's disease. Treatment appeared only in 1940. Almost 80 years there was no treatment for bacteria. So any age, youngest as age 1, sex, both sex, males predominant 2:1. But it's equal in Africa. Many countries in Asia, Africa, Latin America, the significant number of cases, about 1 to 2 million affected all over. Prevalence pool, constant flux resulting from inflow and outflow, new cases, relapse, immigrations, outflow, global, common areas. We can see India afflicted every 22 to 26 people per 1 lakh population. So it involves the skin, mainly as macules, papules. You can see some lesions, single, multiple lesion, hypopigmented, sensory loss. Nerves will be thickened, there will be loss of sensation, muscle weakness will be there. Thickened nerves, that is classical, we can palpate those nerves, loss of sensation. This is the entry through blood vessels, there is inflammatory process in the nerves and demyelination. Okay, so lesions will be like this, hypopigmented macules, which will be without sensations. So you can see lesions in the ears, nodular lesions with the skin coloration, discolorations. You can see other skin lesions like nerve enlargement. You can see that nerve enlarged in that area. You can see complications as nerve involvement, ulnar nerve, palsies, leading to permanent contractures in the hands as well as feet area. Sensor loss can lead to secondary infections and severe deformities due to nerve involvement. That is a chronic important thing. You can diagnose it by laboratory, positive skin smears, nasal smears and scrapings, and also by leprosy. You can see the AFB bacillus in the figure. And leprometers used to determine types of leprosy in injection of a specific inactivated bacilli, positive reaction 10 mm or more after 48 hours, just like tuberculin. What is not leprosy? Have normal feelings, are present from birth, cause itching, white, black, dark colors, scaling, appear and disappear periodically, spread quickly. These are not leprosy. So a person having one or more of the following, like hypopigmented or reddish skin lesion with a definite loss of sensation, involvement of the peripheral nerve or both. Signs due to other like injury, accidents, burns, birth defect are not leprosy. Due to other diseases like arthritis and paralysis are not leprosy. And classification based on skin smears, paucibacillary, multibacillary, borderline leprosy, and in between them the mixed varieties are there. So tubercular leprosy first, less than 5 patches, skin test with the lepromin. It is a strong reaction. Lesions are negative for bacteria and strong cell media response. Peripheral nerves are damaged. Lepromatous leprosy, numerous lesions, more than 5 lesions, symmetrical and positive. Smear test will be there. Lepromatous leprosy cases. Borderline leprosy, 4 or more lesions, well or ill-defined, bacteriological positivity will be there. If not treated, progress to lepromatous. Borderline goes to lepromatous. So leprosy reactions are immunologically mediated, some inflammations which can affect peripheral nerves causing deformity. Diagnosed clinically, not due to treatment. Leprosy 1, type 1 reaction, delayed hypersensitivity type in both pauci and multibacillary, recurrent inflammations of skin and nerve. Type 2, it is a humoral response, but the other one is cell mediated. Only in multibacillary, red painful subcutaneous nodule, there will be lepromatous nodules. Transmission exactly not known. Contact with case intimate repeated skin-to-skin contact. Respiratory route has prescribed biting insects. Human being is the only reservoir. Similar organism detected in wild armadillo. History of handling armadillos are reported in those having lesions. Transmission, basically nasal secretion up to 36 hours. Leprosy stays also in nasal secretion up to 9 days. So contaminated clothing, other formites. Incubation period from 9 months to 20 years. Average 4 years for tuberculosis leprosy and twice that for lepromatosis, 8 years. Treatment, 1941 Promin introduced, 1950 Dapsone, 81 the multi-drug treatment which is Dapsone, rifampicin and clofazimine. So combination of Dapsone, rifampicin and clofazimine is used from 1981 as multi-drug pills therapy. So adults for multi-bacillary we will treat for 12 months, rifampicin 600 mg OD, Dapsone 100 and clofazimine 50 mg once daily and 300 mg once a month. So steps to start MDT: classify, then inform the patient, explain blister pack, explain side effects like darkening of the skin, give enough MDT. So this is once a month, once a day course. So paucibacillary 6 blister packs and multibacillary 12 blister packs, 12 months, 6 for 6 months. 1995 WHO initiated MDT free to give all the patients in collaboration with other facilities. With the MDT, it has gradually decreased. You can see from 85 to 2000, gradually decrease in the cases globally from 85 to 2000. And some patients may develop leprosy reactions, side effects and disabilities following the treatment. So leprosy reactions we have already discussed. With the treatment, 1 to 2 patients per 10 can develop leprosy reactions like patches, reddish patches and nerve pains, fever, malaise, etc. Early diagnosis and prompt treatment will help reassure the patient. Every patient should be informed about the signs and symptoms of these reactions. And reaction with only involving the skin, rest and painkillers are sufficient. All involves nerves, we should start prednisolone, corticosteroid, which will alleviate the symptoms. Drug therapy, red colored urine can be due to rifampicin, darkening of the skin can be due to clofazimine, and severe itching due to Dapsone can occur. Okay, treatment of disability, due to why disability, late diagnosis. So best way to prevent is early diagnosis and proper treatment is the best. Inform the patient all the chance for signs and symptoms, ask them to come to the center. So care of the feet, soak in water, apply Vaseline, use footwear, blisters, do not open blisters, apply clean bandage, simple ulcer, clean with soap and water. So infected ulcer, clean and give antiseptic dressing, wounds, soak in water, protect. Then weakness or paralysis, give exercise and physiotherapy. Care of the eyes, aspirin, paracetamol we can give, atropine or steroid, ointments, cover with iPad. Closing the treatment, post complications, congratulate the patient, thank family members, reassure the MDT has finished, any residual lesions will fade away slowly, that should be highlighted. See, this is a case where there is a complete cure occurring with the multi-drug therapy, so it's a very good thing to start MDT. Control, preventive measures, control of the cases, contacts and immediate event, prevent the disasters or disaster implications, and we can use early detection and treatment is the most important thing. Health education and counseling, so identify the lesion and treat properly, that is the most important thing. So BCG vaccination for TT, this is part of TB control, not be undertaken specifically to prevent leprosy. It provides variable levels of protection. Currently no single vaccines. Control of patient, report to health authority. Isolation, quarantine is not applicable. Immunization of contact not recommended. Investigation of contact and source, specific treatment, multi-drug therapy. Elimination by leprosy means practical with the collaboration of Novartis and other things, World Bank.